this Saturday, Kidney Education Month, Kidney Disease Awareness Month, education and screenings going on at Lyndale Mall from noon to 4. That's near Rogers Jewelers, where that is. It's a free event. The point is you want to try to detect kidney disease because testing is the only way to make sure that your kidneys are working well. Dr. Abha Saxena from UnityPoint Clinic is joining us here on the telephone. Good morning, Dr. Saxena. How are you today? We're glad that you're putting this on because I actually have a relative who has diminished capacity for their kidneys, and you're right, it's something that you don't know about this unless you make a test of it.
Exactly, that's the point. Kidney disease is a silent disease, and people who have it do not know it until the kidney completely fails. So the Kidney Awareness Month is brought to get people make aware that there is a kidney disease which is a silent disease. And if we pay attention and catch it early, we can treat it.
And it's interesting about this is that if you think about going to the store to pick up a gallon of milk, okay, you grab that 1 gallon jug. Imagine you keep on grabbing and you grab another 29 gallons. You could fill up the back end of a pickup truck just flat there with gallons of milk. That's about how much your kidneys filter every day of the blood that goes through your body. It's really sort of the cleaning system, isn't it?
That's exactly right. Actually, our kidney cleans our body every 30 minutes. Every 30 minutes, the whole body gets cleaned. The whole body blood passes through the kidney every 30 minutes.
So what are some of the things that can happen if you do suffer from kidney disease and your body's not as clean, your blood system's not as clean as it should be?
The initial system is, you think about that your body, what the kidney does is takes care of the waste and also gets rid of all the extra fluid from your body. Mm-hmm. So initially people start seeing maybe swelling in the legs, and by the end of the time they start feeling that they just don't feel right. Think about it. If your house is getting cleaned every day and then suddenly it's every other day, then you still cope with it.
Right.
But suddenly it's like once a year. You just cannot live in the house. And that's the feeling, just like that not well-being.
Okay. Now, typically, when you go in to get a kidney test or something like that, you do a urinalysis. Maybe it takes a couple of days or something like that to get information back from the doctor. But from the clinic that's happening this Saturday over at Lyndale Mall between noon and 4 p.m., are you going to have results on site available?
Yes. We'll do the urine dipstick, and we can tell if there is any protein or blood in the urine, and that is a sign that there may be some kidney disease. And we'll also check the blood pressure because high blood pressure is also a major cause of kidney disease.
Yeah, no, that's something that's right because the kidney, despite all of the hard work that it does, it is a very fragile organ, isn't it?
It's very fragile organ. That's why people who have diabetes, the high blood sugar, that causes damage to the kidneys, and the high blood pressure causes damage to the kidneys because kidneys have really small arteries and veins which does the filtration, and those do not tolerate either one of them very well.
Dr. Abha Saxena is joining us here on the WMT Morning Show. She's with UnityPoint Clinic Diabetes and Kidney Center. Doctors and staff are going to be over at Lyndale Mall this Saturday, the 14th, from noon to 4 p.m. They're going to be doing a Kidney Month education and screening event. So people can just stop over there, complete privacy because you're going to be doing the urinalysis. People don't have to worry about anything in that area. But as far as the education, what kind of things do you have on hand to help people get a better understanding of what their kidneys do for them?
We can do one-on-one. That's why all the physicians will be there. We have teaching material which we can give out to the patient or people. They are not patients, but all the people.
Right.
And make them aware that what kind of things can kidney disease cause, what kind of diseases can cause kidney disease, and how it is detected and how it can be treated. Earlier it is caught, the better chance that we can treat it.
Oh, definitely. The earlier it's caught, the better we can treat it. Dr. Abha Saxena of UnityPoint, thank you so much for joining us here on the WMT Morning Show. Hope that you have a full house over there at Lyndale Mall this Saturday, all right?
Thank you. Thanks for having me.